Hello. Good
Hello.
morning.
Good morning. My name is Dr. Daniel Goodman. I went to medical school at Nova Southeastern University. I did my residency in the Bronx. Now I live and practice here in Portland, Maine. Arsenic is considered a heavy metal, and it shares many toxic characteristics with other heavy metals, including both lead and mercury. Arsenic exposure is a public health issue affecting an estimated 100 million people worldwide and 100,000 people right here in Maine. Individuals who are exposed to arsenic suffer from cancers, precancerous conditions, and organ failures. Children are especially likely to have adverse developmental side effects to exposure, especially neurological ones. And by the by, once a filter's in place, it's not going to undo the neurological damage. It might stop more damage, but it will never undo the damage that was done. The human body has a fascinating process for creating energy. Anybody wants to meet afterwards, we can talk about it. I got a few hours. The overall term for this is cellular respiration. Arsenic, no matter how low the amount, attacks this process. By inhibiting cellular respiration, it also stops the prevention of cellular damage at the level of a patient's DNA, while simultaneously damaging the DNA itself. In short, it attacks DNA and then stops the DNA from repairing itself. Cellular damage is a fundamental precursor to cancer. So in short, arsenic attacks every organ system, and with every cellular insult, it increases the risk of cancer. And when you think about every cellular insult being a glass of water, that's kind of scary. Unfortunately, no resident of Maine has to leave their home to find an excellent example of an acute arsenic poisoning. In 2003, when a man put arsenic in the coffee at a church in New Sweden, he hospitalized 15 people, and he killed one person. The patients in the New Sweden incident, like all acute arsenic exposure cases, suffered bloody vomiting, explosive bloody diarrhea, and simultaneously they developed severe hemolysis. That's when your red blood cells literally explode. Severe dehydration was also suffered, as well as renal injury and shock. In addition to doing devastating harm to the body acutely, arsenic also plays the long game. Chronic exposure to arsenic leads to severe liver and kidney damage. It also leads to arrhythmias, anemia, and low white blood cell levels. This is called leukopenia. In short, arsenic does not add insult to injury, but rather more injury to injury. Imagine having problems with your kidneys. Imagine having problems with your heart. Imagine having problems with your liver. And now, on top of all of that, imagine your body's ability to fight off infection is compromised. Ladies and gentlemen of the committee, arsenic is toxic, arsenic is dangerous, and whatever can be done to curb the levels of arsenic in our environment must be done. I urge you to vote to pass LD 454, and thank you for letting me speak.
Any questions? Thank you for being here. Representative, yes.
So, hearing all of this testimony and seeing the data, is there a safe level of arsenic in drinking level?
I'm glad you asked that. No. No, there is not. Arsenic is intrinsically dangerous. Is there a level you could get by without suffering severe damage, severe precancerous conditions? I'm not sure. We can't ethically test people. We can't put them in group C. You get no arsenic, you get more arsenic than group A. In group C, there's the buffet, go for seconds. It's unethical to test with arsenic to determine a safe level because we already know for good and all that arsenic is poisonous and carcinogenic. So in short, no.
Thank you. Representative Perry. Representative, can you turn your microphone?
Thank you. The question I have is that we are exposed to arsenic not only in our water, but in other products,
Right.
actually that are water raised, like rice, and even some of the juices that have water added to it. I think in looking at that, and I guess I'm going to ask you that question, it makes it much more imperative that we test our well water and at least get that part of it down.
Again,
Would you agree?
everything we can do to reduce our exposure to cancer-causing agents and poison, anything we can do to reduce our exposure to those things is a good thing. I mean, or at least I think it is. I feel like maybe there are a few people who might agree with me.
Thank you for being here.
Thank you for having me.
Questions?